Welcome, everyone, to Preventing and Treating Lyme and Tick-Borne Diseases with Alexis Chesney. And I'd like to introduce Alexis. She's a naturopathic physician, acupuncturist, author, and educator specializing in Lyme and vector-borne disease. Dr. Chesney enjoys getting to the root cause of complex chronic illness and partnering with patients to find wellness and balance in their lives. She practices at Sojourn's Community Health Clinic in Westminster, Vermont, and also has a private practice. She is credentialed by many different organizations, including ILATS, the International Lyme and Associated Disease Society, and she's the author of the books Preventing Lyme and Other Tick-Borne Diseases, and Preventing and Treating Lyme and Tick-Borne Disease, Ticks from Around the World, Diseases They Carry, Prevention, and Acute Treatment. Alexis, thank you so much for joining us tonight.
Thank you so much. Thank you, Maria. Thank you, Nellie. It's a pleasure to be here. I love doing this work and getting the word out about prevention especially, but also we'll go into diagnosis and treatment of Lyme and tick-borne disease. But first, I'd like to take a moment to say thank you so much for your work. The Resource Center is such a gem of a resource for people apparently now around the world who have Lyme and tick-borne disease and chronic illness. So if you're somebody who hasn't checked it out yet, please, spend some time looking at the programming that they do and the supportive care that they offer, support groups. And I kind of think of take a penny, leave a penny. Like if you need resources, please take. And if you have some resources, please think about giving, like volunteering or donating a penny or a dollar or $10 or whatever you want. But for today, for now, let's dig in. So I'm going to share my screen, which always is just a slight moment of transition. And make sure it goes smoothly. So let me know if it didn't. So here we are. We're going to talk about prevention, a little bit of diagnosis and treatment. And so overall, I think in my 15 years of working with people with Lyme and tick-borne disease, I see that prevention is the best cure, which is really grounded in my naturopathic education. So first, we're going to talk about ticks. Then we will talk about some tick control and tick bite prevention, what to do if you get a tick bite. We'll also review the top, we don't have all night. We'd need, 12 hours to really dig into every single tick-borne disease and what to do. But we're going to cover the top tier of tick-borne diseases and then treatment, especially acute treatment. And then I'll get into a little thoughts on chronic disease, of course, as well. So first here we have our ticks. They are arachnids opposed to insects. They are either hard or soft. Now the exodid ticks are what we're going to mainly be talking about today. So that's like the deer tick or the black-legged tick is a hard tick. And it has that dorsal shield. We're going to see that comes in handy in identification. They are parasites, actually, because they depend on a host's blood for nutrition. And they're also vectors, which is the organism that transmits a pathogen like the bacteria that causes Lyme disease from a reservoir to a host. Just a little background information on that. And here's a list. I think we have people from all over the world to some degree today. Most of my patients are in the Northeast of the United States, and I know the center is in Massachusetts. So a lot of my talk is going to be really centered in that area, but I do want to have, for example, this list up here because while we'll be talking about the black-legged tick, number one offender out there carrying Lyme and other diseases, we'll also touch upon the American dog tick and the Lone Star tick, which is actually a little bit more in the southern, especially southeastern states, but making its way up to the north. But please know, out on the West Coast, we've got the Western black-legged tick carrying very similar organisms as the black-legged tick. So for the most part today, whatever I say about the black-legged tick, you could basically apply to the Western black-legged tick if you're out there in California, Oregon, Washington. Then the brown dog tick, actually, we only see that this tick causes trouble when we have a large number of dogs together, usually, or certain animals, and they have these brown dog ticks that can carry disease. So things like kennels can create an issue with brown dog ticks, and they can transmit disease. The Gulf Coast tick is mostly in central and southern United States. And then the Rocky Mountain wood tick, like it sounds, out west. The Pacific Coast tick out in California. And these soft ticks, mostly in the western and southern, in areas that have caves, or it's kind of a unique population of ticks that can affect people in places like old buildings or caves, things like that, which is unique. I just want to go through quickly here for some of what we're doing, because there's so much information. I like to pack it in, so I hope that this can be really informative for you. We'll pick up the pace occasionally. So number one, public enemy. This is our black-legged deer tick. So the Ixodes scapularis may carry, of course, Borrelia burgdorferi, which is the cause of Lyme disease. Out in the north central states, we can see Borrelia mayeni that can cause Lyme disease as well. And then we have Borrelia miyamotoi. The infection rate is pretty low, but this is another Borrelia that can cause tick-borne relapsing fever. Then Babesia, actually, we're seeing more and more Babesia in New England. So that causes babesiosis. Could be Babesia microti, most likely for these black-legged ticks. Then we have anaplasma. Vermont has been number one for anaplasmosis incidence in the United States. Go Vermont. So you're at high risk of anaplasma, unfortunately, in that area. And then we have Ehrlichia murus euclorensis. That is only found in a small amount of ticks out in the north central states. And then Powassan virus, again, a lower infection rate than these other pathogens, but still a problem. It can be fatal if that is acquired. And so with each of these slides, you'll see the map as well, which shows you where these ticks are in North America. Now, if you're in Europe, the castor bean tick is another Ixodes species, Ixodes ricinus, which can transmit a lot of these diseases, namely Borrelia garinii, a different Borrelia species that causes Lyme disease. And then there are some others, but for the sake of time, we will be moving on. Then we have the Western black-legged tick, which I mentioned, and you'll see in the map there, they're found out west. So let's take a look at these ticks. They are pretty small, as we know. Maybe you've seen them, unfortunately. And so we have a nymph on the left compared to the adult black-legged tick. Just for those who may not have seen a tick, to drive home the point that, yes, these are very small and hard to find. So prevention is key. Here we have our black-legged unfed female next to an engorged female. One thing I like to mention for this slide is that some people have come in and they may have called ahead of time and they say, oh, I think I had a dog tick because it was bigger. And we'll talk about the American dog tick next. But they come in and they actually have an engorged female black-legged tick. And so the size, I just like to be careful with thinking about the size, because when this tick, well, when any of the ticks start feeding, of course, they're going to enlarge. And so determining which tick this is by size is not the best way. Really, it's that circle. If you see the difference there, that black area near the mouth parts is that kind of black circle, right? So that is called the dorsal shield, and that doesn't change. That doesn't change size or shape as the tick feeds. So that's the best way to really identify a tick. Then below, we see that lovely picture of an egg mass. Unfortunately, the female creating that next cycle of ticks. So let's take a moment for the life cycle. This is helpful in understanding why we see different parts of the life cycle of ticks during different times of year. So it's a 2-year life cycle, so there's a little bit of overlap during the year. First, we start with that egg mass, and then they hatch out to become the baby ticks, the larvae. Now, these are the size of a period at the end of a sentence. Super small. Usually, they're not going to affect humans, which is wonderful. But if you're a child, maybe an adult, rolling in leaf litter, these ticks are really going to stay very low to the ground. They don't have much energy to crawl up that piece of grass and quest to get the passerby, right? So these larvae aren't going very far. So typically, they will not attach to a human, but they will attach to a mouse. And that's when they first actually acquire the bacteria that causes Lyme disease. So they are not born with Lyme disease. They acquire that and most of the other tick-borne diseases as well. So then later, unfortunately, they can transmit to us. And when we talk about prevention, we'll come back to this idea. So just file that away for a moment. So next, the larvae, after they have their blood meal, they will grow another pair of legs and become nymphs. So that is the size of a poppy seed. Again, very small. You can see it a little better than the period, but they will usually winter over and then look for a blood meal the next year in the spring. Now they have a little more energy. Maybe they will get attached to a human or a dog, somebody like that. And then they'll have another blood meal, and the females will then need a third, their third lifetime blood meal to then create the eggs and lay the eggs. So it's usually the adults that we see are the females, which have that nice tan reddish back, and some people really identify that way, which can work, but again, that can become distorted when they are engorged, like that picture we had before, when it becomes that pea-size kind of wrinkly gray shape. You're not going to be able to identify that by that abdomen that is that reddish tan. For tick seasonal activity, I like this chart. It's a little outdated because yes, we have tick bites and transmission in January and February, but other than that, I like this to give us the gestalt of what it kind of looks like. So we've got the green bookends. These are the adults. So in the spring and in the fall, we will see the adults, and that's what catches people's eye the most, right? That's when, people in the spring could be happening pretty soon, where we start seeing those adult ticks coming out as the snow melts and as it gets warmer. And then in June and July, we have the nymphs. Now, these are the poppy seed sized that are harder to see. So sometimes people think, oh, there are no more ticks. The adults are gone. I don't see ticks anymore. Please be careful, June and July, because they're still out there, but it's these smaller ones. Then in August and September, we have more of the larvae that are out. And I hesitate to say this, although it's true, we do tend to see less tick bites during that time. Because as I said, larvae are usually not going to attach to us, and they're not carrying most of the pathogens like Lyme disease anyhow. So we do get a little bit of a reprieve, but as you can see, there's an overlap. There are going to be adults out there. There are going to be the nymphs out there during that time. So please don't get complacent. Keep up your tick bite prevention strategies in August. You can still get a tick bite. But then because of that, I think people then again get surprised in October. I start getting a lot of calls by October something saying, oh no, the ticks are back, and oh, we got a bite. And well, they never went away. But yes, we're having that surge of adult black-legged ticks, for example, as a model here in October in the Northeast. So depending on where you live, this is kind of, the seasonal activity of the Northeast of the United States and North America. And we definitely see tick bites even in January and February. It's been pretty cold this year, but it took a while to get going. So we had some bites, I think in December. So always be careful. Okay, so we talked a lot about the black-legged tick, which is really our focus today, but let's compare to the American dog tick. Now, right away, you might notice it looks a little different, right? It doesn't have that solid black dorsal shield. It is technically a little bigger. I don't like to, focus on that too much, but it is true. And they're brown, actually, brown legs. But again, pretty tiny, so hard to tell. They can carry rickettsia, which causes Rocky Mountain spotted fever and Francisella tularensis. But it's been really nice to know with data collection that the tickreport.com folks do. We'll talk about them later. If you want to test your tick, go to tickreport.com. They have a database from it's probably more than 20 years now. And there are no American dog ticks, at least in Vermont, New Hampshire, Maine, that are carrying rickets, either of these. They don't carry any pathogens, which is awesome. Other areas like in the South or West do have some infection rate, although it's pretty low, but they can have an infection rate of certain tick-borne pathogens. So I tend not to treat American dog tick bites if we know for sure that that's the tick that bit a person in that area of North America. So again, with tick identification, like we were talking about the dorsal shield, this just shows you a little better the comparison, that solid black scutum or dorsal shield versus the hard white mottled scutum of that American dog tick. Lastly, I'd like to focus on the Lone Star tick. Now, this tick is making its way up into New England. We already see them established in New York and Connecticut. Massachusetts is getting more and more Lone Star ticks. I haven't had a patient in Vermont or New Hampshire or Maine tell me that they've had a Lone Star tick bite yet, but apparently they're in the southern areas. A low population, but in 10 years, for example, I wonder if we're going to be seeing more of ehrlichiosis, for example, because Ehrlichia chafensis is carried by the Lone Star tick, and we don't really see much ehrlichiosis in these states, but that may change. We see anaplasmosis, which is kind of like a sister to the ehrlichiosis, very similar, but different pathogen. So the Lone Star tick can carry Ehrlichia and Francisella tularensis, which causes tularemia. Also some viruses, the Heartland virus, the Bourbon virus, and then mysteriously, this is something I really wonder about as well over time if we figure this out. There's this unidentified pathogen that causes something called star eye. So there's discussion in the literature. They actually named a pathogen that they think might be causing this syndrome. It's Lyme-like. It can cause a Lyme-like rash. They called it Borrelia lone stari. But then there are some scientists that are arguing against that. So it's kind of inconclusive right now, which I wonder, is there this epidemic of this Lyme-like illness in the South that isn't Lyme disease, but it is another Borrelia or something similar going on. I hope we learn about that as soon as possible. The other thing that's different about these Lone Star ticks is that they can cause alpha-gal syndrome. You may have heard about this. This is not a disease in the way of a pathogen, a microbe causing disease, but this is a syndrome people get from the alpha-gal sugar that is transmitted in the Lone Star tick saliva. So it doesn't take long to transmit. Most people are not going to have this reaction, but some people have this reaction where you can get allergic symptoms from mammalian meat. So meats like pork, beef, and then it can get into skin products that have these things in it, and even medications like thyroid medications that have bovine parts and all of this. So it can be complicated if you're somebody dealing with alpha-gal syndrome. So as they move up, because I don't see much of this in the Northeast, but as the Lone Star ticks are moving up north, we might see a lot more of alpha-gal like there is in the South. Brown dog ticks. I mentioned this, that there can be some infestations related to dogs. This is found all over, actually all over the world, but it's pretty rare that a brown dog tick will bite a human. It would be incidental. The Gulf Coast tick can carry Rickettsia parkeri and Ehrlichia. The Rocky Mountain wood tick can carry Rickettsia parkeri, which causes Rocky Mountain spotted fever, Francisella tularensis, which causes tularemia, and Colorado tick virus. These are out west. And the Ornithodoros, these ticks carry Borrelias, but these are Borrelias that cause tick-borne relapsing fever. So as it sounds, you can get fevers that come and go. It can be a little Lyme-like, it is a Borrelia, but it is not Borrelia burgdorferi or a Borrelia that causes Lyme disease. So there's that difference in nomenclature and technicality there. Okay, so let's move on to tick attachment times. So I think this is important because this comes up a lot. Like people go, they have a tick bite, they call their primary care, they go to the urgent care and they say, oh, the tick hasn't been on 48 hours, you're fine. Or, oh, it hasn't been on 24 hours, you're fine. There's a lot of myths out there about how long does this tick need to be attached. So I wanted to really look into the literature on this. And now I'm thinking, where is it? There it is, 4 hours. So for Borrelia burgdorferi, this is the minimum recorded tick attachment time. It doesn't mean that if you had that tick on for 4 hours, you definitely have transmission. So I'm not trying to, create hysteria and scare you. But I just want to present this information because it does not have to wait 24, 48 or whatever time. People tend to say it does. Now there's quite a range, right? So the longer it has been attached, the more likely the transmission will occur. Yes. And it's a little bit of a bell curve is what they found. So more of the time it will be the 24 to 36 hour range where you will have more people have that transmission occur, right? But I think it's important that someone not be turned away if they say, well, it's only been attached, 6 hours or 12 hours. And at the end of the day, if you knew when it attached, you wouldn't have let it bite you, right? So how do we really know how long this tick was on? And then here are some other pathogens there that you can see. Also, really important, there are some partially fed ticks out there. So if a tick attaches and gets interrupted when it's feeding, it's sort of primed, right? So it's already like time has passed. They kind of pick up where they left off if they attach again to somebody. So about 10% of the ticks out there have already had partial blood meal. And so for those ticks, it only takes 24 hours for 83 to 100% of those ticks to transmit Borrelia burgdorferi, right? And within 48 hours, all of them have transmitted Borrelia burgdorferi. So that's another thing to think about for the ticks out there. 10% of these are going to transmit much quicker. All right, so now we're going to transition from ticks to the actual diseases. So this is, quite the schematic here. I go into all this. I have a course. If you're interested, I talk about ticks and then tick-borne diseases from around the world, and we go through all of these plus more. So for today, we're going to focus on Lyme disease, anaplasmosis, and babesiosis. So Lyme disease, you may have heard, was discovered in Lyme, Connecticut by Dr. Alan Steer, who was seeing a lot of children in the 1970s with juvenile arthritis, but then realized, this is actually caused by a bacteria. And so in 1982, across the Sound in Long Island, Willy Bergdorfer was studying ticks. And he found that actually there was bacteria in these ticks, and then named after him, Borrelia burgdorferi. The Lyme disease was named after him, that pathogen, and it made sense that in that area we saw really the epicenter of Lyme disease. Now the symptom onset is 3 to 30 days after a tick bite. So I always tell people to watch for symptoms for the 30 days after that bite. So we'll look at some maps here. I love my maps, so bear with me. So here's 2022. This is the CDC, we'll go through what we think about the numbers there. They claim that incidence is actually higher than reported. So in 2019, the CDC reported about 35,000 Lyme cases, but they admit that the figure only represents about 10% of cases. So that means there's about 350,000 new cases in 2019. Then there's also a study that's looking at health insurance claims from 2010 to 2018. And so there were about 30,000 to 40,000 cases of Lyme disease reported annually during those years, but it looks like the health insurance claims showed that about 476,000 patients were diagnosed during those years. Because I started practicing in Vermont, and so I have a lot of patients there. I always look at this map, and then we'll do Massachusetts because you guys are based there, so we'll cover a lot of people that way. So here's 2022 for Vermont. We had the second highest incidence of Lyme in the United States. Number 1 was Rhode Island, number 3 was Maine. This is the most updated numbers that we have at this point. Or at least a month ago. They tend to come out maybe around this time. So then we have a situation in Massachusetts. So they actually stopped engaging with the way the CDC does surveillance. So if you look, say, on the CDC website, you'll just see a blank, like as if no cases of happened in Massachusetts after it was like 2016 or something. So yes, of course, there are cases in Massachusetts, but they're doing it a little differently. So at least here we have a map so we can see really those hot spots for Massachusetts. So in 2022, looks like you guys made it to number 8 in the country. All right, so now we'll go through some signs and symptoms of Lyme. So we have that erythema migrans, this really perfect bullseye rash, right? This happens all the time, right? No, unfortunately, it does not always happen. If it does, yes, that is a telltale sign of Lyme. But less than 50% of people with Lyme who've been diagnosed recall this perfect bullseye rash. So, of course, looking at all the other symptoms and reporting those if you experience them is super important. But if you have this, in a way, I feel like it's helpful, right? Because it's screaming out, I have Lyme, and then we get treatment in there right away, and it makes all the difference. So this can happen 3 to 30 days after the bite. And, just to distinguish from local irritation, typically some people can have just some, irritation, maybe a half an inch or less around that bite. That wouldn't be this erythema migrans Lyme rash. But once it's over 2 inches in diameter, that would be the actual Lyme rash. And usually that local irritation goes down, and then this is a totally different experience, totally different rash that happens usually a little later. So it is different. But that is diagnostic of Lyme. The thing is, it can look different, right? There are all these different ways it can present. So it can have lesions, it can, you can have this bullous rash with the blister, you can have these hard to see around the sides, borders, and then the disseminated rash. I mean, that's pretty obvious, but some people just aren't aware that you can have many lesions all over. And usually when this happens, it's these perfect bullseyes. I've seen that before, and it really is pretty incredible how circular and bullseye-like they can be all over the body. But yeah, you could have one on your back, right? So thinking about those 30 days after a tick bite, making sure to look in a mirror, have a partner with your tick checks, of course. Also, if you had a tick bite, to check that area to see if there's any rash, because usually these rashes, you don't feel them. Some people do, and it might be a little warm to touch or something like that. But a lot of times they don't itch, doesn't hurt, but there's that change that is visual that you need to see. And then in people with darker skin, this is super hard to see, and you might miss that. So taking a real close look and noting any changes in your skin if you have darker skin is really important. Black patients actually have 5 times the odds of disseminated disease, and having it at that stage, that means like, we missed, maybe there was an erythema migrans that we would have caught in somebody else, but we missed it in the darker skinned individual, maybe because it's hard to see. And we really need to increase that education around looking for that. So other symptoms, flu-like symptoms, of course, fever, chills, sweats, like you have the flu. A lot of people are having the flu nowadays, so sort of like that part of it, that achiness. You can have swollen lymph nodes, joint pain, joint swelling, typical Montauk knee, they called it, because Montauk was on Long Island, is that one swollen knee in a child with Lyme disease. Muscle pain, fatigue, headache, stiff neck. Now, Lyme can affect the heart, so there could be chest pain or shortness of breath, palpitations, fainting. Lyme can also affect the eyes. There might be redness or itching, discharge, floaters, and it can affect the brain. So early on, people can get Bell's palsy, which is a facial nerve palsy. So basically, it's usually one-sided, so you'll see a drooping of the face and loss of muscle control there. And that would happen within those 30 days if that's going to happen. There are other neurological symptoms that can happen within those 30 days. Sometimes it comes on later after other symptoms did happen within those 30 days. Numbness, tingling, weakness, cognitive issues like brain fog, mood changes, personality changes, even seizures, pain with eye movement, ringing in the ears, hearing loss, vertigo, difficulty with balance or walking. Moving on to anaplasmosis. So this is a bacterium that was discovered in 1993. It's a gram-negative bacterium. It infects the granulocytes, a type of white blood cell in the body. And the symptom onset is 5 to 21 days after a tick bite. So here we have the United States in 2019. We can see there's a lot more anaplasmosis, where the color is a darker purple in the Northeast and North Central states, but it's really quite spread throughout. Here we have Vermont in 2019. And since 2015, Vermont has had the highest incidence of anaplasmosis. Quite the high achiever in tick-borne disease. So we see it's more in the southern counties. And then Massachusetts from 2013 to 2022, that darker color, you see a higher incidence. So let's review signs and symptoms. I'd say the biggest, the most common picture would be high fever and the worst headache of your life. Most of these people go to the emergency room. Sudden onset. Now with Lyme, you can get a fever. I'd say usually it's 100 to 102. There could be other things going on that feel awful too, right? With anaplasmosis, often it's 103, 104, 105. Really high fever, people get really worried and cannot function. So it really interrupts your life. And then the headache part. So that's the most common thing. Of course, these other symptoms can come up, and there's certainly an overlap in symptoms between all of these tick-borne diseases, but just to give you a sense, like that's the hallmark picture. But you can have muscle pain, fatigue. With this one, you could also have some GI issues like nausea, vomiting, abdominal pain, loss of appetite. You don't see that as much with Lyme. And you could have a cough. Now, there's a rash that you could get with anaplasmosis. I haven't seen it. It's pretty rare, but it can happen. And it's definitely very different from the Lyme rash. It is not just concentrated around the bite. It would be a full body rash, except not on the face, palms, or soles. And it's kind of splotchy. It's kind of like the Rocky Mountain spotted fever rash, if anyone's seen that. It's related. It's a rickettsia illness. So, and then there can be some lab changes. If we have any medical people out there, I go into all this in the book and in the course. So there's low red blood cells, low platelets, you can see low white blood cells. Sometimes you can pick that up early on. But for anaplasma, I also want to say, you get this sudden onset of horrendous symptoms, which is awful, but also helpful in diagnosis. People often get help right away. They get a blood test that is accurate. If you get a tick bite and you acquire symptoms within those 5 to 21 days, even if it's day 5, that blood test is accurate, which is unlike Lyme, right? So that's really helpful. And the treatment works. 2 weeks of doxycycline cures anaplasmosis. So even though it's a pretty awful experience, I always joke that it's the one that out of any of them, that's the best to get. So babesiosis, moving on to this next tick-borne disease, was discovered by Victor Babes in 1883, first diagnosed in 1966. So this is not a bacterium, this is a protozoan. So that just means a lot in the world of treatment, right? So your antibiotics will not treat babesia. You need antimalarials, typically, as they're called, antiprotozoals, so different medications and different herbs. Although in the herbal world, yes, there's a little more overlap. So it infects the red blood cells, and it actually ranges in presentation. Some people actually do not get symptoms, but then it can actually be fatal on the other end. Now, symptom onset is from within several days after a tick bite to a few months. Here we have our map, a little bit more in the northeast, north central states, and out west. We've got Vermont, more so in the southern areas. And there is a lot of babesia in Massachusetts, especially out in the Cape and the islands. We see a lot of babesia. Signs and symptoms of babesia. So you can also get a fever with babesia, chills and sweats, fatigue, headaches. Usually the headache people describe as a pressure sensation. So that's something that you could kind of note particularly about babesia. Muscle pain, joint pain. We don't really see swelling of joints like we do with Lyme. Maybe loss of appetite or nausea. It can also cause swelling of the spleen or of the liver, and even jaundice. So the typical picture that I see with babesia also includes, which might be on the next slide here, chest pain. Yeah, we're going into that. So excessive sweating, including night sweats, chest pain, palpitations, and something we call air hunger. So air hunger is basically a difficulty breathing, but not on exertion. So it's not like you climb the stairs and you're out of breath. You're just sitting there or laying there at night, which is the typical presentation, laying in bed at night with palpitations, also having this shortness of breath, air hunger experience. And then this cough kind of come in there as well through that experience. So that's a very unique, classic babesia manifestation. All right, so you've gotten a taste of the ticks through North America and the top tick-borne diseases. Now we're going to talk about tick control and tick bite prevention. So let's understand where ticks like to live, and then we can go from there. So they can be active when it's over 28 degrees Fahrenheit. So I think that's super important to note that they do not die when it's under 28 degrees. They can live, just they're dormant, so they're not active, but they go to sleep, so to speak. When it's under negative 20 Fahrenheit, that is when they can die. So without that super, super cold climate in New England, although maybe some places reached it this year, but if it's not sustained at that temperature over the winter, that's why we're having higher, there are a lot of reasons. That's one reason why we might be having, higher populations of ticks. And so they are most active over 45 degrees. So you might not see them all running out there in the 30s, but by the time spring comes and you're getting, over 45 degrees, you'll definitely see more ticks. And they really like humidity. So that's also important to note. They're going to be in places that are moist and shaded, places like leaf litter. They also like border areas, like going from a yard of grass to the wooded area, places around like wood piles or stone wall, garden, going from, grass to garden, that kind of thing. Those transition zones they like. And they also need hosts, right? So small mammals. So if you know that there are a lot of mice out there, especially, then there are going to be a lot of ticks out there, most likely. So here's a little image to just show some things you can do to reduce tick habitat around the home. So taking those gardens or structures, places that you like to be, out away from that transition zone, and some of our tick control will come in handy when looking at this as well, targeting areas like stone walls and wood piles, etc. Keeping the grass short, although keeping it short doesn't mean no ticks will be there, but at least it decreases the humidity for them. All right, so thinking about host management. So first we have our white-footed mouse. Now 75 to 95% of those baby ticks become infected by feeding on this mouse, right? So we talked about that earlier through the tick life cycle. So certainly important to think about targeting and interrupting that cycle, right? Let's interrupt this process before those ticks even get Lyme so they can't transmit it to us later, right? So that's where tick tubes come in. There's a great website, thermacell.com, that you can actually get these tick tubes. That actually the ticktubes.com I just found is no longer, but you can also make your own. So, so what is the point? How does this work? So you see the little mouse there with that cotton. So we stuff these tubes full of cotton or some kind of wonderful material that mice like, that's been treated with permethrin. And we put it out into mouse habitat. Basically, mouse habitat is tick habitat. So all the places I listed before, those are the places you go to, and you put these tick tubes out. And what they'll do is they'll be excited to find this material and bring it back to their nests. And then once that permethrin is touching them and their family members, it'll kill the ticks on them. Doesn't actually kill the mice, for better or worse. I always get that question. It will kill the ticks. So it's pretty amazing. There's research on this. And if you want to do it yourself, you can totally do that. You can save paper towel tubes. Some people get PVC that they put out and they just stock them every so often, restuff them. And you can do that yourself. There's a video that I did with Project Lyme that goes through how to do this yourself if you're interested in that. And then you can collect lint or you could use cotton balls, whatever you want to use. treat that with permethrin. We'll talk about permethrin more. This is a chemical. It is toxic to our skin. So if you use permethrin, there are many ways we will talk about using it today. Be careful when it's wet. When it's wet, it is toxic to our skin. So put on gloves when you're spraying it on materials. And here we are. So it is a synthetic pyrethroid acaricide. So originally it's from chrysanthemum flower, but they've taken it to a level where it is not as safe for us as chrysanthemum flower if we touch it when it's wet. It paralyzes the ticks and can actually kill them. So it's an amazing way to prevent tick bites by using permethrin. We'll talk about on things like our socks and shoes and clothing and our tent if we're out camping, or a picnic blanket and that kind of stuff. But here you're using it for those tick tubes. And so we've got, here's our little picture of our mice, and they're killing those ticks there. And there have been many studies on this. So over 8 years, there was a 93.6% reduction in exposure per hour to infected ticks in treated areas in New York, where they use tick tubes. Pretty amazing, right? So I highly, highly recommend this. I've done it myself. I've had patients, from 1 year telling me how everybody in the family is getting tick bites all the time, to the next year after implementing this, seeing no ticks, maybe seeing 1 or 2, huge difference. So I highly recommend it. Yeah, so next we can talk about the white-tailed deer. Often there's such a focus on the deer, and really, like we just talked about, I think the #1 animal to kind of target is the mouse. But the deer are also important to think about. But now we're at a different life cycle phase, right? So this is the adult tick that we're thinking of, because 90% of the adult black-legged ticks are going to feed on deer. And interestingly, the deer are not reservoir, like they don't have Lyme, but they sustain the nymphs and they provide blood, which is a super important time for an adult female to get a blood meal, so that they can then put out those eggs. So this is also a really important time so that we like stop that next generation from coming out, right, of ticks. So there's this 4-poster tick control deer feeder device. And oh, okay. So I didn't provide a whole, I go into this a lot more in the book and the course, but basically they're putting bifenthrin on those little rollers. And so when the deer goes in to eat that food, they'll get that rolled on them, and that will kill. It's another acaricide that kills the ticks. And it's been very effective as well. There's a lot of research on that. So treating the landscape. Speaking of bifenthrin, this is a pyrethroid, like I said, an acaricide, tick killer, that works. It's similar to permethrin in some ways, and can be used. So I mention it because for treating the landscape, it is, actually just to go back, it's concerning to use this, and I don't recommend it, but a lot of the studies out there are always comparing, because it's so effective, right? Well, how did bifenthrin work? Compare the essential oils or whatever other kinds of more natural things we want to use in the landscape to the bifenthrin. So it's important just to let you know about that. So unfortunately, it is highly toxic to aquatic organisms, honeybees, and other beneficial insects, and some toxicity to birds. So let's probably not spray that on the grass. So now let's talk about essential oils. There are these organic volatile compounds from aromatic plants. They attract pollinators and seed dispersers to the plant. Thinking of nature, like how this actually works, and then actually using that in a way to repel ticks from us, because it's repelling from the plant. So it's kind of interesting, the biomimicry idea, right? So it is a challenge to evaluate these studies, though. So I spent a lot of time trying to do that, and I've gathered some good takeaways, but there's such a lack of standard of methodology, like apples to oranges to bananas. Just, yeah, totally hard to compare one study to another. So one of the highlights, though, from that study, my research would be something called eco-exempt IC2. And some of you maybe have done this before. So there are some pest control companies that will come to your land and spray it with something like eco-exempt. It used to be the IC2, and this is pretty amazing. It's, as good as I think it gets right now with the essential oils. So it suppresses 100% of the Ixodes scapularis, which is the black-legged tick, for 2 weeks after the application. And then looking at 5 weeks after, it's keeping them down by 63% regarding the larvae. And even so, for the adults, it suppresses 93% of the adults for 14 weeks after the spray. So that's pretty amazing. Of course, you need to do it again. And so having them come back and reapply is important. But the thing that happened was, now there's this thing called the Centrio IC3, and it's replaced the eco-exempt in a lot of places. So if you talk to a pest control company to have them come to your property to spray, if you can find eco-exempt IC2, it's definitely more effective in what I've read than the Centria IC3. But there is also that Centria IC3 to consider at this point. And then I have people that, create their own formulas, and you can get creative and do it yourself too. Now, the big thing that we're waiting for is Newt-Ketone. I can't believe I still am saying this because it's been, I don't know, 8 years probably. It's still not on the market. So we have wonderful studies about this essential oil of grapefruit. It's also found in the heartwood of yellow cedar. 5% concentration of Newt-Ketone suppresses 100% of nymphs of both Ixodes scapularis and Amblyomma americanum for 2 days. So for 2 whole days, that's a Lone Star tick. So this is maintaining an efficacy of more than 65% up to 21 days after application. So this is just extremely promising, and I really hope that it will be out on the market soon, as I've been saying, but I think it'll be a real game changer. So if you want to keep your eye out for this, or ask your pest control company about it and get them to keep their eye out about it, I think this will be extremely effective. Okay, so turning from the landscape to the person, so thinking about tick bite prevention. So high-risk populations, these are a lot of my patients. So farmers and landscapers, people who work with animals like veterinarians, people who like to horseback ride, gardeners, people that are outdoors, right? And even people that just like to go outside and take a hike or walk through their yard. So of course, these are high-risk populations, but really, I think it's important to note that all you have to do is walk across some grass anywhere, and in a tick endemic area, you are then at risk for a tick bite. So what are we going to do about it? So we've got permethrin-treated clothing and gear to think about because it is highly effective against tick bites. So we mentioned the permethrin earlier. So this is a chemical tick repellent. But I see great things. I highly recommend this. I do it myself as well. So people wearing permethrin-treated sneakers and socks are 73 times less likely to get a tick bite. It's pretty huge, right? So if you just want to focus on socks and shoes, you can put it on your calendar. This is what I do. So maybe we can all do that this weekend to get ready for the spring. Put it on your calendar, go outside, wear gloves, use permethrin, spray down your sneakers, get a few pairs of socks, make them your permethrin-treated socks. And you can do it yourself every 6 weeks because it will lose efficacy if we do it ourselves every 6 weeks. And then there is an option because, hey, why not think about clothing, right? So there's a study looking at workers in North Carolina that did a factory-based technique, and they had a 99% decrease in the rate of tick bites during work hours. So pretty amazing. They did, the full head to toe clothing in permethrin. And so you could also do your own clothes. And like I was saying before, you could do, if you're going out backpacking, you could do a sheet to put down for a picnic, a tent. You can permethrin, your backpack, to make sure that you're protected. Again, be careful. Don't get any kids or pets near it when it's wet. Wear gloves when it's wet. Once it's dried, you can pick it up with your hands. And if you wanted to send some clothing away, you could do so, or even a sheet. Like, I have a sheet that I sent away and it's going to last a long time. So go to insectshield.com and you can let them treat some items, and then it lasts for 70 washes, which they say is the life of the item, basically. So that can be really useful. So for example, if you're a gardener, or, if it's more of a hobby kind of thing, then you could have maybe a couple of sets of clothes that you get done by Insect Shield, and then do your own socks and shoes every 6 weeks, doing a combination of these things, usually thinking about all the different options for tick bite prevention. And I always challenge my patients, like, all right, what's it going to be this year? What haven't you done yet? Let's go send those clothes out to Insect Shields and have that, when you go on your trip or something. If you're somebody who's really out there every day, we're going to talk about maybe taking something called the deer tick bite formula. If you're a farmer who's just getting tick bites all the time and you want some prophylaxis, we'll get to that. But you also might want to just do a whole bunch of your clothing to use the permethrin. I have farmers that do that. You can also buy clothing with it already treated. All right, if we want more of a natural approach, if you're not comfortable with that, or if you want to do this in addition, because if it's really hot and you're wearing shorts, the ticks, will look for that skin. So if you don't have permethrin on your legs, which you should not spray on your legs, you're then prone to a possible tick attachment, right? So for either clothing, of course, you can use Texas cedarwood oil, or if you want to use it on your skin safely, you could use this cedarwood oil. So I like Cedarside. So you can go to cedarside.com and they're excellent. And actually there was a study in 2022, which was really cool to come across, that showed the repellency was as effective as DEET on black-legged ticks. The thing is, though, what they noticed in that study is you need to apply this every 1 to 2 hours. And DEET doesn't actually last as long as we hoped it would. So you have to reapply DEET as well, probably about 4 hours for that. So yes, of course, DEET is an option. There's some concerns about neurotoxicity. I'd say low concerns, but they're still there. So if you'd rather something natural, this works very well, but then you do need to be super diligent about reapplying. And Nutricoton, again, I cannot wait for it to come out, because that will be simple to apply that. And apparently it gave 100% repellents for 3 days. What a long time. It's amazing. So Nutka Shield is apparently what it'll be named. Keep your eye out for that one. Of course, we've got our traditional tick check. So after you've done your best at preventing tick bites with permethrin treated socks and shoes and Cedarside tick spray, come inside and you can do a tick check. Hopefully everybody's doing this already, and we want to kind of up our game. But if you're not doing this yet, please do a daily tick check after being in tick country. So this just shows, the areas that ticks love to be on. Probably most of the tick bites I've seen are in these areas because they're dark, they're moist, they're warm. That's what they like. So you've got to really take a good look at these places. And in kids, I can't tell you how many kids I've seen around the ear or in the scalp. So really, you got to look through the hair. I always talk about like, nighttime brushing the teeth. So if you get in the habit, hopefully everybody's we're brushing our teeth every night. So we do a tick check at that same time. And if you've got kids, if you've got many people in the family, line up and help each other, look through each other's hair, look at each other's backs, help each other out. Also, after you come indoors, you could put your clothes in the dryer. So this is another option. So think 6 for ticks. So high heat, has to be high heat for 6 minutes, and that will kill ticks. So you can also do that and then do your tick check after that. And then just a note, because of course we think, well, maybe we want to wash these clothes first, right? But if you do that, the ticks can survive the washer, and then you have ticks crawling around your washer. And then when you put the clothes in the dryer, you then need to put it on for 55 minutes because it's really the heat, right? We talked about ticks love moisture. They need moisture to live. So the heat is drying them out. It's the drying that kills them. So they will be okay in the washer unless it's, super high heat in the washer. But most of the time they're going to survive. And then you need to then dry them out, which is going to take longer, right? So that's the idea there. Okay, so you've done all that. You're not going to get a tick bite, but if you forgot any of those steps, what are we going to do if we got a tick bite? All right, 6 steps after a tick bite. First, we're going to remove and identify the tick, apply first aid, send the tick out for testing, begin a treatment protocol, and watch for symptoms. And then maybe later get tested if you were to acquire symptoms. So here we have my favorite tool, the OTOM Tick Twister. I highly recommend it. In the beginning, I was using regular method, and it just was, I was macerating these ticks. It was horrible. So the tick twister, especially this one, because I've used other tick twisters and sometimes they don't quite attach. Anyway, highly recommend this one. It's always worked very well. If not the first time, the second attempt always works. It's great. After you remove the tick, save the tick, put it in a little plastic bag. Then we're going to apply first aid. So you can put andrographis, which is an herbal tincture, on the bite. If you don't have that, that's okay. If you have deer tick bite formula, put that on the tick bite. If you just have alcohol or peroxide, put that on. Something that's antiseptic at least would be helpful. The idea, unfortunately, to give you this nasty image, is the tick can actually, once it's attached, it can release feces onto the skin, and in these feces can be the pathogens if the tick is actually carrying pathogens that's in the feces. So then often people might, look at the bite, point at the bite, touch the bite, and then we're dragging in those feces. So don't touch the bite, take the tick off, use an antiseptic or something antimicrobial like the andrographis that's specific to Lyme, and wipe that off. And then I also get feedback that actually it just overall heals better, which is really nice. So that's a bonus. And then you can take homeopathics. Now, the homeopathics are not going to kill Lyme or tick-borne diseases. So I want to make sure that we know that. I'm not saying you would take these instead of an antibiotic or herbs if those are indicated, right? But in the beginning, if you're at home, you've got this waiting, great. Let's get it started. The Lidum 30C is what you take after a tick bite. And it's 3 pellets. Some of you might know those Boiron blue bottles. Typically, of course, there are other companies. You put 3 pellets under your tongue 3 times a day for 3 days. And this is going to help your immune system work better in the face of any tick-borne disease if it's there. If the bite is causing some itching, if it's hot, if it's red, If there's a rash, you can then add Apis, and you can take them together. Same dosage for that. Now, of course, if you have something that looks like a Lyme rash, please don't just take Apis and think that will totally clear it up and it's all gone. Please tell a healthcare provider and get proper treatment if it is Lyme disease. But these are great to do to help your immune system right in the beginning. All right, step 3, testing the tick. So we want to find out what kind of tick is this. Maybe you will be a pro at tick identification, but they will confirm that. And what pathogens are they carrying? Maybe the tick isn't carrying any pathogens. That would be great. So then you don't need to do anything. Excellent. Go to tickreport.com. Technology is another option. Tick Report's right in Massachusetts. I love them. You do the online form, you mail the tick out. Usually in 3 business days, you hear back, and then you find out if the tick is carrying any pathogens, right? Lyme, anaplasma, whatever it might be. And then you can take more action if you wish, and you have more information, right, that we'll be applying here. Step 4, consider some treatment. So first there's pharmaceutical treatment. So I'm a member of ILADS, International Lyme Associated Diseases Society, and they recommend considering 20 days of doxycycline after a tick bite, especially within 48 hours of the bite. I tend to recommend an herbal treatment if we have no symptoms, and if you start it right away after a tick bite. So you could do them in conjunction. So there's deer tick bite formula. You could also do 20 days of doxycycline with this. I don't recommend the one-time dose of doxycycline because I don't think it's long enough. I don't think I have the slides in here. So I'll just mention, because I go into detail about this in other places, but you know, the studies on that are just so poor. It really doesn't prove that it works. So I hesitate to have any confidence in a one-time dose of doxycycline after a tick bite. You could choose to say, well, I want to do one-time dose of doxy, and then I'll take deer tick bite formula for 30 days. That's okay. But I don't think one-time dose of doxy that we have confidence that it works in and of itself. So back to the deer tick bite formula. So there are certain herbs that I've chosen based on Stephen Buhner's work. He's an herbalist. He wrote Healing Lyme. You may know about that book. If not, it's an amazing book. So the idea here was to target the specific pathogens that can be carried by the deer tick, right? So number 1 is Lyme, but also Anaplasma, Babesia, Ehrlichia, Powassan virus. So it has an overlapping herbs that will cover all of that. And the herbs work in not just that way, right? So in botanical medicine, we know just how interesting and fascinating, amazing herbs are because they have a lot of different constituents and they're working in a lot of different ways along with our immune system, right? So we're actually activating our immune system in the face of any tick-borne pathogens to help us kill off, not just do it itself, but also help us use our white blood cells and cascade of things to actually kill the bacteria or parasite or whatever it might be. And also an ingredient in there will target biofilm. We'll talk about biofilm that can be formed around these pathogens that can be problematic. And then even more of a bonus is that these herbs will help joint support, neurological support, heart, eyes, and liver support. So you can choose to do that for 30 days after a tick bite. You could do it while you're waiting for tick report to come back, or if, in the moment you didn't think, oh, I should save this tick, or you couldn't, you lost it. Obviously, this happens. So you could choose just to do the 30 days after the tick bite. As you are watching for symptoms always and reporting any new symptoms you might have. This is a breakdown of the botanicals and the target pathogens. And so we've got Cryptolepis, Houtunia, Japanese knotweed, and cat's claw. Those are the ingredients in there. And so after a tick bite, you would take a teaspoon 3 times a day. for 30 days. And then I mentioned earlier, if you are someone who is high risk, like a farmer or logger or something like that, outdoors all day long, some people choose to do a preventative dose as a prophylaxis during tick season, right? When is tick season? Well, most of the time. But if you want to target those times where we know the ticks are active and take a half of a teaspoon 3 times a day of the deer tick bite formula, that is also an option that you can do. And you can start and stop it. So also, if you're going camping for a week and you're just like out there, you can do it for that week, and then maybe you're back to an office job or something. You can do it like that. That's fine. Of course, talk to your doctor before you start this. In the book, I have side effects and interactions and all that stuff that you may want to know about. Step 5. So we've done the testing of the tick and the first aid, and we might have started our deer tick bite formula. Now we're still going to watch for symptoms over the next 30 days. So there's a long list. This is basically the deer tick or the black-legged tick possible symptoms from all of the pathogens they carry. So you probably will not experience all these things, but to keep an eye out for them. Of course, there can be other causes of these symptoms, but if it's within that 30 days from a tick bite, this is important to report to your healthcare provider, hopefully a Lyme literate healthcare provider. Step 6, get tested maybe. So if you develop symptoms after the tick bite, you may get tested. Now, this is a whole discussion in and of itself. We talked about anaplasma testing and how accurate it is, which is great. For Lyme testing, it is not accurate until 4 weeks after. So some people have, I hear these kinds of stories. They, had some symptoms. They went to urgent care or their primary care. It was 2 weeks after the tick bite, and they were tested. Lyme came back negative. Or even they had a very clear, obvious bullseye rash or Lyme rash, but the test was negative. Well, there was not enough time for those immunoglobulins to have been made. So it is not going to be accurate. You do have to make sure time has passed in order for that to be accurate. Now, another note, I know there are going to be questions about this, so we'll talk about it now about testing for Lyme. The regular tests out there, as you may know, aren't very accurate anyway, even if you waited those 4 weeks, right? At least it's going to be better. But if you get a test, I don't recommend the ELISA test. That one's less than 50% accurate. I would recommend the Western blot from a regular lab if you wanted to do that. People do that because it's covered by insurance, but not every hospital lab will skip the ELISA test and do the Western blot. And it's a lot of details to keep track of, so it can be very confusing and hard to actually get that ordered for yourself. But if you did that, if you got the Western blot, that one's about 60% sensitive or accurate. So it's a lot better, about 60 to 70%. Now, an even better test would be the immunoblot through a company called IGeneX. Now, this test needs to be ordered by a practitioner who has an account and who knows about this lab, right? So that can be a challenge. Of course, this is the type of testing I do. And if you are looking, we're going to come to this somewhere. If you're looking for a Lyme literate practitioner, you can go to ilads.org, ilads.org, it'll be up here soon, and find somebody who is aware of these better tests, right? Because an ELISA test from a regular hospital lab that's negative to me in my training does not rule out Lyme disease. So it's also important to get more accurate testing. Oh, and the accuracy of that better IGeneX immunoblot is 90%, which is awesome. And they, I don't know, in the last 3-4 years, they updated it, and it includes Borrelia that is also found in Europe and around the world. So it's really looking at all Lyme, which is awesome. So just a little side note on that, because I know people are interested in that. So here's a tick preparedness kit. So I put together all of these items that we talked about just now. So I have this, if you're interested in it, you could put it together yourself, but then you have that preparedness kit and you're ready to go if you got a tick bite. Okay, we're getting toward the end, so hang on. Then we'll get to questions. So we're moving on to acute Lyme and tick-borne disease. And I say that because it is a very specific approach compared to chronic, right? There's always that tick bite that somebody has known about, or a sense that there was a tick bite and acute symptoms like a fever, which is a little different from chronic presentation typically. So here's that list. So if you're experiencing any symptoms, I definitely recommend considering a Lyme literate practitioner. So we've got ILADS, Global Lyme Alliance, and LymeDisease.org. These are organizations that can help you find throughout the world a Lyme literate provider. Okay, let's start with Lyme and really any Borrelia. So tick-borne relapsing fever would be under this column as well for treatment. Just to review 2 standards of care, which I alluded to earlier when I was talking about testing. So we've got the Infectious Diseases Society of America, which also looks at CDC guidelines. And then we have ILADS, International Lyme and Associated Diseases Society. All right, so I also mentioned earlier that ILADS guidelines recommends 20 days of prophylactic antibiotic treatment after a tick bite, and that patients with early Lyme disease may best be served by receiving 4 to 6 weeks of antibiotic therapy, not the typical 7 to 10 to 14 to 21, depends on who you talk to, days of antibiotics. And then cases of chronic Borrelia burgdorferi infection require individualized treatment plans. Very important. And this doesn't even talk about co-infections, right? What if you have Borrelia and Anaplasma or Babesia, which requires a different treatment, right? The point is it can be complicated. So here we have our shapeshifter, the Borrelia burgdorferi bacterium. You see that little spiral guy over there? That's a spirochete. And then we see that blob in the middle, cyst form, also called a round form. In the literature, they changed. Now they call it a round form. And then these biofilms, super interesting work by Eva Sappi. She's documented this and done such awesome research at the University of New Haven. So she was showing how a bunch of spirochetes can get together. They have like their own communication system. They have ways of reproducing and sending out these blebs, and it's like a whole universe unto these biofilms. Very, very fascinating and a little scary, right? A little creepy. So just to say, this is complicated, and doxycycline by itself isn't really going to cure this, right? So we need to think about in treatment getting to the cyst form, round form, and also the biofilm. So this is a template. This may not be for you, but this is like a starting place that where I start with a lot of my patients. So we may start with something like doxycycline for acute Lyme. So 200 milligrams twice a day. And there are things that you need to avoid. Some people don't know this if they've been treated already for Lyme. So interactions happen with minerals like calcium, magnesium, and iron when you're taking doxycycline. So you want to keep dairy products. Some people then drink almond milk instead, but that's even higher in calcium, actually. Be really careful. Or multivitamins. It's not that you can't have those things, but at least 1 to 2 hours away from the doxycycline. Also be careful of the sun. So right now is like, a fine time to take doxy for the most part in the northern North America. But if you are, in other parts of the world or traveling to Mexico or southern Florida, it may not be a good time to start doxycycline because of the sun, or know that, okay, you need to be indoors basically, because you can get a terrible sunburn. It quickens sunburn, and my dosing is higher than the 100 milligrams twice a day that's typically given by mainstream doctors. So that even makes it more quickened, right? So it can be very serious. So over the summer, I don't do a lot of doxy, or we just have to really talk about it and really be careful. We don't want to create another problem of skin cancer, right? So it can be, yeah, very serious. Other options, there's cefuroxime, azithromycin, sulfamethoxazole, trimethoprim, minocycline. There are many antibiotics to choose from, and that we often will rotate through over time. So this part, we'll get to any of those that I just mentioned. We'll get to that free form of the spirochete. And because we're using antibiotics, I will use nystatin. So nystatin is an antifungal. So in addition to probiotics, which bring in the good bacteria again, I add nystatin, which is a prescription, and that will decrease the fungal overgrowth that can happen in the gut when we're using antibiotics long term. If it was a 7-day regimen, maybe you don't need it, but we're going to do a 30-day regimen. So it is helpful, especially like with women, and sometimes they can get vaginal candida yeast infection. So I want to prevent another problem, right? In addition to that, then we can add something like the Lyme Formula 1 or L1. So that has cat's claw, Chinese cat's claw, Japanese knotweed, and andrographis. So those herbs together are going to actually get to the spirochete form as well, but they will get to the round form of Lyme. So that's super important to add something for that. As an alternative, we can use grapefruit seed extract. If you use this, just a side note, I have to stop my side note. But grapefruit seed extract, you might hear about grapefruit juice can interact with a lot of medications. Grapefruit seed does not. However, it depends on how it's extracted. There are some companies that use benzoyl chloride, I think, that will actually create the same type of interaction with certain medications as grapefruit juice. But if you don't use that chemical, which Allergy Research Group does not, that's why I chose that one. So I recommend that one. Or if you'd have a conversation with whatever the manufacturer is, we don't want to use that chemical to extract the grapefruit seed because of those interactions. Anyway. Next, you could choose to add some supportive formula. So in acute Lyme, this might not be as much of an issue, but in chronic conditions, I'm always talking about a lot of different things, thinking about, what are the different systems that are affected in the person, supporting the immune system, the neurological system. For example, this Lyme Formula 2 has knotweed, kudzu, red sage, and bicull skullcap. That can be really helpful in that way to help the person. So this is like an optional part. The non-optional part next is serapeptase. So that is an anti-biofilm agent. Super important to add something to break through those biofilms. So serapeptase is one option. There are many others, lumbrokinase, nattokinase. So using that twice a day. Empty stomach, super important for any of these enzymes, because on an empty stomach, they will go to the site of the biofilm and digest through that biofilm. But if you have food in your stomach, it's going to digest your food and it won't get to the biofilm. So important note. And then treat for 2 months always with Lyme past the resolution of symptoms. So you have a tick bite, 7 days later, you get a rash and fever. We start treatment. In 3 days, you feel totally better. From that point on, we treat 2 more months. And that's the best case scenario. That's the best. I love it. When we treat acutely, I can see that. And that can be how it is. And it doesn't have to be this horrible experience that Lyme chronically can be. Anyway, so definitely, but treat the 2 months. past the resolution of symptoms, and then it will be cleared. It can take longer than the 3 days at the beginning, I know, but sometimes when you get it that quick, it really is a quick experience, which is nice. Acute anaplasma. So this actually, you could just do that doxycycline. I would add the serapeptase. It's 2 weeks long. I see people do just fine with that. It can be really simple. If you want to add the nystatin for that period of time for an antifungal, sure. Probiotics, definitely think that's a good idea. And not everybody that I work with chooses to do the formula. I don't think we need it necessarily, but if you wanted to add some extra support, you can add that anaplasma formula for some anti-anaplasma herbal action. So if you want to do it all, you could. And lastly, we're just going to talk about Babesia because these are the top 3 that I see acutely. So Babesia is a totally different treatment. So important to know it's a parasite and infects your red blood cells. So we need to use atovaquone, for example, an anti-parasitic, and azithromycin. And they together will synergize. Azithromycin is an antibiotic, yes. With atovaquone, they work together and they kill Babesia. Atovaquone is a very nice yellow liquid, a little strange, but it is important to know to take it with fat. It'll absorb better. Do not take it with CoQ10. Stop CoQ10 while you're on this. And eventually, in a month, if you're on it for a month, then you need to monitor liver and kidney function. I rarely see an issue with that, but it's good to be careful. You could add Babesia formula, Cryptolepis, Seta acuta, and Bidens for some extra support. And then the red sage, the Salvia militariza, that's to help the endothelium and the red blood cells because of the action that, Babesia is in your red blood cells. So that's some extra that you could do. Serapeptase, Babesia does cause biofilm as well. Created around them. So we want to break through using one of these anti-biofilm agents like serapeptase. And then, of course, if you have something like azithromycin in there, we want to use probiotics to bring back the good guys. You could also add nystatin here. And there are also other options, right, for any of this. They're just, I always individualize my treatment plans, a lot of different things to consider. So thank you for coming through this journey with me. I hope I provided some good nuggets of information for you. Here's some offerings if you're interested. If you wanted to find the Deer Tick Bite formula or tick preparedness kit, you can. Preventing Lyme and Other Tick-Borne Diseases is my book through Story Publishing. You can find it anywhere you find books. You can also find it on Amazon, yes. In the library, it'd be great to get all of the libraries to carry it. If you want like a super summary, basically, with links of what we just talked about regarding the prevention part, you can go to my website and sign up for my list, and then you get this really substantial handout that gives you a lot of good info, kind of summarized from the prevention part. So that's dralexischesney.com. And you can find me there if you are ever interested in a consultation. I also have some videos up on other subjects. So there's a lot of resources there too, I hope, for people if you're interested. And I also have a course that goes into ticks and tick-borne diseases from around the world. So if anyone was interested in learning even more, it's over 6 hours, over 200 references. It's taught in an accessible manner because I want everyone to be able to understand, but at a level where medical professionals will definitely learn a lot too. So everybody's welcome for that. So now we have questions. Thank you.
Alexis, thank you. That was really comprehensive. And I know we're running a little late, but if it's okay to stay for a few minutes for the questions, one of the first things that someone asked was about permethrins and the toxicity to cats. Is there a problem with the cats eating the mice?
Yeah, I get that question a lot.
Yeah.
So I forget the exact number, but there's a study out there, and I've talked to a few professionals on this, and it's like some exorbitant number of mice that a cat would need to eat to actually have any negative symptoms or die from it. So the conclusion is it's safe, that it won't affect the cat.
And once the permethrins are dry, is it still, if you've treated clothing, say, is it still toxic to pets?
Once it's dried, it's fine for cats or anybody to touch. Yeah.
Okay, the next question is, what's actually happening when you receive a positive for Lyme, but they say it's not active?
Yes, well, could be a lot of things. So there are certain antibodies that the test is looking for. If you just do the ELISA test that I mentioned earlier, it's like a yes, no. We don't have enough information to really know if it's a yes or a no. If you get the Western blot, then we have, for people who've had it done, there are a bunch of numbers, 18 kilodalton, 23, 31, et cetera, that print out, and then you know which ones might be reactive or not. So there are certain bands or certain antibodies in that test that are Lyme antibodies. And it's those antibodies that, if they're positive, in my training, we just need one that's a Lyme specific antibody. So somebody might have a non-Lyme specific antibody show up on one of these Western blots. But if a Lyme specific antibody shows up, so that's 23, 31, 34, 39, 83. So if one of those numbers is reactive, then to me, that means there was an exposure to Lyme, right? So this still doesn't even mean for sure that you have Lyme right now that's active, right? But it means that at some point you were definitely exposed to Lyme. Now, if that was 20 years ago and you received treatment back then and you feel awesome, then you can still have that test come back positive, and you probably may not still have Lyme disease, right? But if as we're looking at things clinically and we're correlating things, and you have never had Lyme before or treated it before, and you have this test and it's positive and we have the symptoms, and okay, yeah, let's treat for that. Absolutely. Hope that helps.
Another permethrin question. If permethrin treated clothing gets wet, say in the rain, or if you're canoeing.
Yeah, if it gets wet, it's fine. It's tightly bound. The permethrin's tightly bound to the fiber, and it's only through time or agitation that it will be released. So a puddle or rain or going in water, it's okay.
I have a partial question here about heat and saunas. Could you complete your question? I'm waiting for the rest of the question to come in. Does heat, hot baths, or saunas help kill spirochetes?
Sure, if you really get your temperature up, so the idea is like a fever treatment, if you accomplish that through a sauna or any other method for that matter, yes, you can kill off bacteria. Even if you don't get that high, if you're not raising your temperature, it can be very beneficial to utilize sweating because of the detox effects. And we often talk about the Herxheimer reaction, which is that worsening of symptoms that can happen after starting a treatment from die-off. And when we have the die-off, these bacteria can release toxins, and it's those toxins that make us feel worse. So if we do things like detox support, many ways to do it. One is, yes, sweating, getting the toxins out through our skin. So that can be very useful.
And do you have recommendations for repellents for very young children?
Yeah, I'd say the tick shield, that's that cedar side, if you want to go fully natural, but then you have to run after them every 1 to 2 hours and reapply. I've used, and people, you can totally use permethrin treated clothing and socks and shoes with kids. Mhm.
Any other questions? Please type in the chat. I think you were very thorough, Alexis. There weren't a lot of questions this evening. You covered a lot of ground.
I tried. Thanks for sticking with me. I just like to give as much information as I can. Of course, there's so much more we could talk about, but I hope you have gotten some nuggets of information and yeah, no more tick bites.
Thank you so much. Everyone who's here tonight, do know that we will be sending all these resources and links. Um, Here, we have a couple more questions. Can you totally get rid of Lyme?
I think it's possible, yes. I've seen people, I guess I can't say I've lived the lifetime of any of my patients to check in with them, right? So with that limitation, yes, I've seen people heal and stay symptom-free. And on the topic of testing, we can talk about this too. There is a Lyme culture test now. So IGeneX 2 years ago came out with the Lyme culture test, which they had been working on for many years. We're very excited finally. So that's what I get excited about. It came out. And so now I offer that as an option too. So that is looking for actual bacteria. So whereas the testing that we just talked about is all about the immune system's reaction to coming into contact with a bacterium and making these antibodies, the culture test is looking for the bacteria. So that is an option. It's unfortunately expensive, and hopefully that fee will be coming down eventually. But it's $875 right now out of pocket. So of course not everyone can do that. But doing that 2 months, I think that's also key, because a lot of times I'll get calls back. Like if somebody was, you know, finished out treatment, or we thought they might have, and then they call in 6 months and they have symptoms again. Sometimes when we like really go back through and like, okay, so how long did you take this? They're like, yeah, I felt good, so I only did it for 2 weeks. I mean, I totally get it. After you've gone through all this treatment and you're feeling well again, who wants to keep treating, right? But I think that's key, really treating long enough at that end, that 2 months passed. So yeah.
Someone was asking amoxicillin as a replacement for doxycycline, because they can't take doxycycline.
Oh yeah. So yeah, there are a lot of other options. There's azithromycin, cefuroxime, cefdinir, Bactrim. So of course, that's just a discussion to have with your provider about that. And yeah, if there's an allergy or intolerance, usually there's something else to choose. Or, I work with a lot of people who are very sensitive, and they may actually be allergic to many, many things, or just have sensitivities to them. And so, moving on to looking at herbals, or other, there are a lot of options to kind of talk through and consider.
I have a question. Someone's asked, they're in Bennington County, and they're wondering which of your offices is closest.
Yeah, so right now I'm just doing telemedicine, and Sojourns is closed to new patients for me. So the best place, if anyone for that matter, wanted to work with me, it would be my private office. And so that's scheduled through my website, which is dralexischesney.com. So DR is in Dr. AlexisChesney.com. Yeah.
Let's see. Here's a question. I understand there are homeopathic kits as remedies for Lyme. Do you recommend anything specific?
Homeopathic kits. So there is a company called Desbio. I don't know if you're talking about that. I would use that as a treatment. So that there's something called boba. There was some fun names in these natural products. So that is a homeopathic. But if you're talking about like the ledum and the apis, I wouldn't use that for like with the intention of treating Lyme. That would be more for prevention and helping your immune system in the face of after a tick bite and possibly having some pathogen transmission. I know there's some other remedies out there, of course, things I probably don't know about, obviously, but like Lyme nosodes and different things. I don't have experience with other homeopathic approaches other than I think what I mentioned. Yeah.
I think that's it. Thank you, everyone, for those great questions. Know that a recording of this will be up on our YouTube page and our event page in the next few days. You have to give us time to do a little bit of editing, and we'll get that up there. And also, we have other events posted. I want to thank Alexis for her precious time this evening. It was a wonderful presentation, and all of the links that we've been showing you in the chat will also be in an email along with a link to the video.
Great. Well, thank you so much for having me. Thank you for the great questions, and thank you for sharing all the resources. May everyone be tick-free.
Thanks so much, Alexis, and I hope to see you again here soon.
Absolutely. Take good care.
Bye now.